Hello, everybody. We're back here with Coach Kara, and today I'm hosting the beautiful, talented entrepreneur, Christine. Christine and I, this is not our first time hopping on a Zoom call together, but she's just such a wealth of knowledge. She's also a mom, and I know there's so many questions out there about the mom proverbial pooch, obviously the breathing exercises, and I know that this program here is more or less based on stress, but she's going to walk you through some of the different things that you can sort of work on for your posture, for your breathing, and then of course to get rid of or to at least combat some portions of that pooch, which is the bottom part of your stomach kind of bulging out a little bit more than we want to. And if anyone's going to know what they're talking about, it's this lovely lady here. You should follow her definitely on Instagram, and I will absolutely put her handle underneath because she is a wealth of knowledge. And it's not just specifically in the core area, it's anything to do with your neck, your spine, your knees, your hips, everything. So highly recommended. So without further ado, Christine's going to take us through a few different things on breathing, posture, and then also your pelvic floor. So take it away, Miss Christine.
All right. Thanks, Kara. You're so kind.
Yeah, absolutely. Thanks for being here.
My pleasure. So yes, one of the most common complaints I get from moms is like, I'm exercising, I'm doing everything, I'm never going to get rid of my belly. And moms know, like, as soon as the baby pops out, we put them on one hip and we're like doing this whole thing and loosening our core, not activating. And then when we stand and also carry our babies and we just kind of keep this posture, we bring our hips forward, lean back, and I'm really exaggerating it, but this is what we all look like to some degree, some more than others. And so the hips are forward, and then the spine goes back, and then we kind of curl the upper back and then push out against this pooch here. And so that's what we call a pressure belly. And if we just do some really simple adjustments in the way we stand, that actually almost immediately goes away. So instead of having the hips forward, and I actually can't get my hips as forward as a lot of postpartum moms can because I'm used to correcting myself. But if we just, instead of being here, bring your hips back, just that simple thing.
Hip width apart right now, Christine?
My feet, yes, they are.
Yeah, okay.
Yeah. And maybe a little more narrow. Okay, so instead of like leaning on the passive structures of the hip and then pushing out, just bring the hips back so that there's more weight in the heels than the toes in your feet, and your hips are stacking over your heels. And then tuck, a little bit of a posterior tuck, and rib cage down. That just changed the whole thing from here to here.
And you can see it.
So yeah, right. So that pooch suddenly becomes a lot less noticeable and much more controlled when we just fix the alignment issue. And then when we can get, like normally with my patients, we practice the alignment and then we keep the alignment. So rib cage down, rotate, and then we'll do something like a squat. So you have to maintain that back position and this contraction as you come down into a squat and come up. And so the trick is to be able to be in tune with your body enough that you know how to get into that correct alignment and then maintain the alignment for your functional movements, whether it's just, you know, going from sit to stand or carrying your kids or carrying groceries or Costco boxes or whatever, or more deliberate exercises. So alignment and knowing how to activate the right muscles is critical.
Would you say that at the beginning, if they're starting to practice these types of stances and obviously proper form, would it be painful for them or just uncomfortable until they're, no, it shouldn't be, correct?
No, it's not painful. It's just unfamiliar. So it feels weird because we stand in such a wonky position, we start to tell our brain that that's what straight feels like.
Right.
So now we all think that this is straight, and you do this and you feel like you're hunched over.
For sure.
We have altered our perception of a midline in our body. And so we have to reprogram that.
And is there a way to do that if you're standing like against a wall, or is it recommended that you're not standing like, say, structured right against the wall to practice the tilt and the alignment?
I usually have women start in supine, meaning laying on their back. So I'll show you what that's like right here.
Okay.
Um, so just let me know if you can't see or if you can.
Okay, I can see you perfect.
Okay. So I'll have women start in this position. And the first thing we do, make sure your knees are not together. You want them parallel and facing the ceiling. The first thing we do is just practice doing a pelvic tilt. Now, most women are going to do that by bracing through their core, but I actually don't want a bracing through the core. What we want to see is a tilt with the core relaxed. And so that alone usually takes a good full physio session to get.
Yeah.
But women can do it at home too. You could just kind of practice pushing down through your heels, allowing your pelvis to roll backwards. I recommend a quiet room, eyes closed, and just trying to get in tune with your body. So push your heels down, allow it to roll your pelvis back, and try and keep your tummy relaxed.
And you can really see it even when you're talking about that too.
Yeah.
I mean, you can tell that you're using your tilt as opposed to, you know, engaging your core.
Yes. So the reason we want to let the core relax is because if we're using our core, you're probably 99.9% using the outer core and not the inner core. And the problem with the mom pooch is that that's what we're doing. And the same thing would be seen as we're doing like a curl up or a sit up. A lot of women kind of almost go into a triangle in their tummy.
Yes.
And that's again because out of the 4 ab layers, we're only activating the outermost ab layer, but the pelvic floor and the transversus abdominis is not being activated. And that is really the foundation and the corset of the body that holds us all together and that gives us that flat tummy look. Okay. But more from a physio perspective, apart from aesthetics, it's really important to have that activation to protect our backs. And then women that are leaking when they cough or sneeze or jump or laugh too hard, that's all from that weak pelvic floor and from not activating our transversus abdominis.
Okay, so when you're doing like a say a sit up in this position, you're going to be focused on pressing those hips in and up and also the lower back to the floor, or is there some other cue that
let me walk you through this.
Okay.
So first we have to start with the pelvic floor. What that's going to be is imagining that there's a tampon in. You want to constrict, you want to squeeze the tampon, and then you want to pull it up. So you would squeeze it and pull the tampon up towards your ribs. Okay. So that's a pelvic floor contraction that we want to start with. And you want to do that in both holes, like your vaginal hole, but also in the anus. Okay. And so everything, we call it stitch the holes. So you can constrict and pull it up. And a lot of us, what we do is the opposite. We push outwards and, especially postpartum women, because, well, that's the last way that's how we delivered our baby, right? We put everything we could into pushing out, and now we need to kind of draw that back in. So yes, so the way we coordinate that with breathing, and that's gonna really help our body function as a unit, but also plays into all of your stress things. So we want the pelvic diaphragm and the breathing diaphragm to move together so that they move down together and they move up together. Okay. So as we take an inhale, we contract the pelvic floor. So inhale, contract, exhale, let go. Inhale, contract. Sorry, you know what? I think I messed that up. Hold on. No, that's right. Okay, so inhale, contract, exhale, let go.
Okay.
That way we keep them moving together. So if you just practice that pelvic floor contraction with the inhale, and then as you exhale, you let everything relax and go.
And this seems
Inhale, pelvic floor.
really help with stress as well, because I mean, breathing exercises in general, but it seems to me like it's very relaxing.
Exactly. Exactly. But it tells the body how to function.
Right, which is super important.
So that's where we start, is that pelvic floor contraction with the breathing. So like that. And we practice that, try to get that. You're not going to see an external, you're not going to, no butt clenching, no inner thigh clenching. It's really the holes that we want to be doing the contracting. As soon as you get that, you mix it with the pelvic tilts. And then as soon as you get that, we want to now activate the deepest core muscle, which is the transversus abdominis. And one of the best ways to get that is to get that pelvic floor contraction first.
Okay.
And then put one finger on each hip, and you want to imagine a way of how to bring your fingers closer together. Or if there was like a barbed wire between your hips, you want to shorten that wire. And so try and figure out what muscle is contracting to shorten that wire. And I'm going to show you the difference between a diastasis recti that has that transversus abdominis contraction on and one that doesn't.
Okay.
Let me just bring the bed a little bit closer for that. So if you've ever been pregnant, you have a diastasis, whether you know it or not. It's just the degree to which you have one and how much it's healed. So the way we assess it is not how wide it is, it's how deep it is. Usually we get right around the belly button, we check right below and right above, and we'll have you do a curl up and then assess how deep you could push in. So I'm not sure if you could get an assessment of kind of how deep I'm going there and in here. That's right through my diastasis.
Okay.
Okay, can you see how deep my fingers are going in?
I can. Is it either on the top or the bottom, or is it just the full length?
Both.
Okay.
Both, yeah. So I've had 2 pregnancies, so I've got a good one. But it is mine is pretty stable. So that's how deep I could go without stabilizing the lower or the deeper abdominis. So now if I put that pelvic floor contraction on, activate the transversus and do a head curl, can you see?
I can see
that I'm going a lot less.
Okay.
So now I've got a stable base against which my outer core can work. It like tightens up and just gives a full like corset effect internally.
Right.
And then now my core can work. So instead of my tummy doming as I do a sit up, now it stays flat as I do a sit up.
Absolutely.
So the way we do
in, correct? Because I know obviously there's some extra skin and maybe some stretched out areas there from being pregnant.
Yeah.
That'll absolutely help to shrink that area, correct?
Absolutely, yeah. So the way we do exercises is just as important as doing exercises.
Absolutely.
So you're not gonna get a flat stomach when you're doing it wrong over and over. And the other thing that the research talks about is frequency of exercise. So we want to basically increase enough passive stiffness in the muscles to hold us in. And the best thing is every other day, and you want to do it for 2 years. Wow. 2 years. So it's quite a long time. You wouldn't consider surgical intervention until you've done that or tried to do it conservatively. But basically, optimal tissue adaptation occurs when it's every other day for 2 years.
Okay, that makes complete sense. Wow, wealth of knowledge, seriously. So in any other tips for women that are, struggling with that sort of self-confidence around that piece, like to encourage them to stay active and to stay, motivated to do that for 2 years? Because I think that's also, a kicker. A lot of the times we start something, we want to see the exterior results so much quicker than what's going on inside of our body. But I know that you're all about, repairing what's going on internally before you're going to see an external result.
Yeah, but to be honest, the result is, if you know how to control your body, that's already a successful result. And as soon as you know how, it might be difficult at first to start standing in a better alignment. It might be difficult at first to hold that contraction over and over, but you increase your body's ability to do it. So as soon as you build that mind muscle connection, you're already there. You just have to continue doing it so that you provide that tissue adaptation to shorten. And you've got to trust in the process. There's lots of research behind this.
Yeah, 100%. Well, honestly, I can't thank you enough. Guys, please go and follow this lovely lady because she puts out so many fabulous videos, not just for the pelvic floor or your pooch area. So please go follow Christine, and honestly, you won't regret it. By the way, she also comes to your home. That's what her business is. She does physiotherapy out of your home. If you don't live locally, I feel bad for you because you're missing out on this lovely lady to be in your living room. But guys, honestly, I can't thank you enough, Christine. We're going to do another couple little training sessions, more on shoulder and neck pain. I mean, this just isn't popular, I think, as you know, the pooch area, but I can't thank you enough, Christine. I hope you have a great evening. And
thank you. It's a pleasure.
Okay, girl.
Okay. Take care.